This portion is brought to you by Mercury Drug, nakasisiguro gamot ay laging bago.
Today on Generation RX Plus. Sakit sa tuhod, gawa ng knee injury. Paano ba ito nangyayari? At paano ito malulunasan at maiiwasan? Alamin in Ask the Experts. Ang isa sa pinaka-popular na sport sa bansa, ang bowling. Like to know more about this very lucrative game and the health benefit it provides? Find out with The Good Sport. 2 women, 2 sisters, and 2 winners. Alamin kung bakit sila sumisikat ngayon sa larangan ng bowling. Sina Lara at Apple Posadas. Kilalanin sila sa Secrets of Your Sports Hero. Looking for the right stuff that will protect your car from the heat of the sun? Know more about this sporty-looking accessory that might be the one for you in Executive Toys. All these and more on Generation RX Plus.
Good morning. Join me as we tackle the issue on knee injuries, which can be very serious if not treated properly. This is your host, Dr. Cecil, and welcome to Generation RX Plus.
Hi, good morning. Today we'll be talking about common knee injuries. I'm Rich Pason. I'm an orthopedic surgeon specializing in sports medicine. Normally, we get injured if we're not conditioned. If you don't have proper conditioning, muscle balance, muscle build up, and also the mechanics, we're prone to injuries. Common injuries, surgical, ACL, meniscal tear, and ligaments and tendon injuries. For console, or the most common console is actually patellofemoral pain syndrome. It's in layman's terms, it's your kneecap grinding on your thigh bone. Why? Because your muscles are weak. At the same time, your kneecap's plastered on the knee bone, on your thigh bone, so it's destroying your cartilage here behind the kneecap and also your cartilage in your thigh bone. Normally, if you're an athlete, you're well conditioned. You're always there for workout, training. Training is it's just like your lifestyle. For a normal person, we call it like what? Weekend warriors. So they play like basketball, they play weekend, every other weekend. Of course, your muscles are not conditioned, your body's not conditioned, but you get more prone to injury. If you're a kid or if you're growing, you normally have we call it jumper's knee. So it's actually the pull of the tendon pulling on the bone. So if your growth plates are still open, actually your bone copes. So that simply your bone tends to grow. So normally we call it the ones who play basketball, soccer, badminton, volleyball, or track and field usually get jumper's knee like mine. Bowling, I have lots of patients with knee injuries with meniscal tear. Because why? When you bowl, you have a certain technique to throw the ball. Same time, there's also twisting of the knee. So if you're older, tendency you scrape your meniscus. That's why you get meniscal tear. Preventive, it's still a lifestyle. Proper stretching, proper warm-up, same time proper conditioning. You just have to have a lifestyle, like just a daily routine you have to do. You just stretch every day, or just normal stationary bike every day. That will actually help a lot already. If you have swelling, inflammation, of course, start with anti-inflammatories, cold compress, rest, elastic bandage, the compression, and of course elevation. Afterwards, if the inflammation has subsided, that's when we do conditioning. So you have to condition the muscles that you normally use. If you're a basketball player or an athlete, you have to treat condition your thigh muscles, especially your VMOs. And I always tell my patients, it's the muscles that help and also protect the knee joint or the joint itself. To sum it up again, what we try to, preach to our patients, always preventive conditioning, preventive medicine. So what we have to do all the time, if you're an athlete, if you want to go into sports, you need to have proper conditioning, proper nutrition. And if you want to drop by, we're here and we have a sports clinic here in My Health, Shangri-La Mall, along EDSA, Shaw Boulevard. We're here Tuesday, Thursday, Saturdays from lunchtime to 4 o'clock. And see you Saturday.
Thank you to Krisha for my blouses and La Mesa Eco Park. Again, this is your host, Dr. Cecil Katapang for Generation RX Plus. Remember to live well so you can play well.